Hello, this is Dr. Jose Marcano. Today we're going to take a look at doing a class 1 cavity preparation with the I+ laser. Here are the settings. We're looking at 4.75 on the energy and 50 on the pulses on H mode. As you can see, I just started on this prep on tooth number 14, and here I am using the laser again at 4.75 and 50 pulses per second. The reason I use this setting is to desensitize the tooth. This helps the patient not feel any discomfort when you use a low wattage at a high pulse rate, which spreads the energy in 50 different pulses. So after I've done these four, what you can see is about maybe 20 to 30 seconds, I switch to a higher mode. Here we have 8 watts and 20 pulses per second, 80% air and 50% water. Now with this setting, it will go ahead and cut enamel and remove the decay. You can take a look at the tooth right here in tooth number 14, how it is working. Now, one of the things that I want you to look at in this preparation is that the absence of the high-speed suction. Whenever possible, you can use the slow-speed suction. What's going to happen is that all that water being delivered by the I+, it's going to be delivered to the tooth, and it's not going to be taken away from the tooth and from the laser, therefore causing sensitivity. It is really important that the tooth gets cooled down by the water, and that water that the I+ is delivering is delivered to the tooth, not to the high-speed suction. And here we have 50% water, 80% air, and as you can see with all the little sparks, what's happened is I am removing enamel, all composite, and decay that used to be on the central groove towards the buccal. So with this setting, the patient, it's not feeling anything. Even though it's a high setting of 8 watts, you're spreading it 20 times at 20 pulses per second. And as you can see, this preparation takes probably no more than 2 minutes. I haven't timed it, but this is not edited, So here we have the laser doing its job. The patient is not feeling any discomfort at all because we prepare it with a 475 and 50. Now, in the case that the patient would be feeling this, then what we can do is lower the wattage maybe to 6 watts, and then you're spraying 6 watts over 20 pulses. Here you can see the whole preparation. The stain that was on the central buccal area on the occlusal, it's gone, and you'll see a little bit of the bonding that I use, and I didn't want to bother you with all the details of filling the tooth and all that, and then you'll see the finished product at the end, where you can see that you have a great restoration on a patient who was in a hurry. She was an assistant from the endodontist next door, and we did this filling in 5 minutes. No anesthesia, no pain, 2 minutes.